The pharmacy window shatters at hour 11, not hour 1. Not day 3, hour 11. That's the average across 42 documented grid-down events in urban centers over the last 30 years. 11 hours after the power fails, after the broadcasts stop, after the cash registers go dark, someone puts a brick through that glass. And once it starts, you have between 40 and 90 minutes before the pharmacy is completely stripped. Not by organized looters. By your neighbors. By the people who smiled at you yesterday. Here's what nobody tells you. Pharmacies are not robbed for drugs. They're gutted for survival infrastructure. The opioids and stimulants go first because people are predictable. But those people are not your competition. They're your timer. While they're tearing apart the controlled substance cabinet in the back, you have a narrow window to extract the 6 categories of materials that will determine whether you survive the next 6 months or die from an infected finger. You are not looting. You are performing triage on a dying supply chain. The pharmacy contains the bottleneck resources that collapse faster than food, faster than water, faster than ammunition. These are the materials that hospitals run out of in 72 hours during a crisis. The things that stop being manufactured the moment the grid fails because they require intact industrial supply chains. You cannot make these in your basement. You cannot substitute them with folk remedies, and you cannot acquire them once the herd realizes what they actually needed. This is not about morality. This is about the reality that pharmaceutical supply chains are the most fragile infrastructure in modern civilization. 3-day inventory models, just-in-time delivery, single-source manufacturers on different continents. The entire system is optimized for efficiency, which means it has zero resilience. When it breaks, it does not bend, it shatters. And the materials you need are gone in the time it takes to have a conversation about whether it's ethical to take them. Most people walk into a pharmacy thinking about prescription medications. They're thinking about their own pill bottles, their own diagnoses, their own maintenance drugs. This is why they fail. Prescription medications are identity locked. The bottle has your name. The dosage is personalized. The supply is tracked. Even in collapse, those bottles are useless to you unless they happen to match your exact medical profile. And if you do have a critical prescription, you already know you need it. You don't need me to tell you to grab your insulin or your blood pressure medication. What you need to understand is that the pharmacy is not a drugstore. It's a concentration of 6 categories of materials that restore capability in collapse conditions. These are not products. They are system-level inputs. They patch the gaps that appear when hospitals stop answering, when wounds stop healing, when infections stop responding to wishful thinking. The 6 categories are not secret. They are not hidden. They are sitting on shelves right now, 20 feet from where you're standing, and you walk past them every time you pick up a prescription because you have been trained to ignore them. The first category is the one that runs out in 18 hours. Not 18 days, 18 hours. And it's not what you think. It's not antibiotics. It's not painkillers. It's the material that makes every other medical intervention possible. And it's the one thing people forget until they're holding a wound that won't stop bleeding and they realize they have nothing to stop it with. We'll get to that. The second category is invisible. It's sold in the baby aisle and the diabetes section, and it determines whether you can sterilize anything after the water stops being safe. Most people grab alcohol. Alcohol is obvious. Alcohol is also the wrong answer for 90% of what you need to do. There is a better option sitting 3 feet away, and it costs less, stores longer, and does not evaporate. The third category is illegal to stockpile in some states, not because it's dangerous, but because it can be converted into explosives. This is a red flag that it's essential. Anything that's useful enough to be restricted is useful enough to prioritize. You are looking for a specific compound, not a brand name. The brand names are marketing. The compound is what matters. The fourth category is time. Not metaphorical time, literal time in the form of chemical stability. There is a class of medications that does not expire the way you've been told. The expiration dates are legal fictions. FDA requirements, liability shields. The actual degradation rate of these medications is measured in decades if stored correctly, and the pharmacy has them in bottles that most people ignore because they are generics, because they are cheap, because they seem too simple to matter. The fifth category is sedation. Not for you, for the people around you. There is a scenario where someone you care about is in pain you cannot solve, and they are loud. And loudness in collapse is a death sentence. You need the ability to create silence, to create sleep, to create compliance when compliance is the only thing standing between your group and detection. This is not about control. This is about mathematics. One screaming person can compromise 20 silent people. The sixth category is the one that nobody takes because nobody believes it will matter until it does. It's not medical, it's psychological. It's the thing that keeps people functional when their brain chemistry starts eating itself under sustained crisis conditions, when the adrenaline runs out, when the fear turns into paralysis, when decision-making stops. This category does not fix the situation. It fixes the ability to process the situation. You have 6 categories, you have limited time, you have limited carry capacity, and you are competing against 2 groups. The first group is the addicts and the opportunists who go straight for the controlled substances. They are fast, they are focused, and they do not care about anything else. Let them have it. They are clearing the path for you. The second group is the unprepared majority who will arrive later, who will take everything that looks familiar, who will strip the shelves of bandages and cough syrup and anything with a label they recognize. You will be gone before they arrive. This is not a shopping list. This is a doctrinal extraction protocol for the 6 material categories that create medical capability in grid-down conditions. Each category has a threshold, a specific quantity that crosses from useful to redundant. More is not better. More is weight. More is visibility. More is the reason you get stopped at a roadblock and lose everything. If this sounds cold, that's because it is. The pharmacy is not a community resource once the window breaks. It's a zero-sum logistics problem. What you take, someone else does not have. What you leave, someone else will waste. The herd takes based on familiarity. You take based on function. That is the only edge you have. If you want the breakdown of all 6 categories, the specific compounds, the dosage logic, and the storage protocols that keep them stable for years, then stay on this channel. This is not entertainment. This is infrastructure knowledge. Subscribe now. Leave a comment if you've already walked into a pharmacy and realized you wouldn't know what to take if the window was already broken. Most of you haven't. That's the problem. Category 1 is hemostatic capability. You have 6 liters of blood. You can lose 1 and stay conscious. You can lose 2 and survive if the bleeding stops. You can lose 3 and you are dying faster than any intervention can save you. The gap between losing 2 liters and losing 3 liters is often less than 4 minutes. Hemostatic capability is your ability to stop that timer. Most people think bandages, gauze, pressure. This is correct for small wounds. For anything that actually threatens you, it is useless. A severed artery does not respond to pressure the way you've been trained to believe. The volume is too high. The pressure is too great. The wound channel is too dynamic. You need a material that accelerates clotting at a chemical level, not a mechanical one. You need a hemostatic agent, and the pharmacy has them in 2 aisles that most people never look at. The first option is in the first aid section, but it is not labeled the way you expect. You are not looking for Band-Aids. You are not looking for rolled gauze. You are looking for a specific type of gauze impregnated with kaolin or chitosan. These are minerals and biopolymers that trigger the clotting cascade on contact. Kaolin is refined clay. Chitosan is derived from shellfish. Both work. Both are shelf-stable for years. Both are available over the counter. The brand names vary, but the active ingredient is listed on the package. If it says kaolin or chitosan, take it. If it does not, leave it. The second option is not in the first aid section at all. It is in the women's health aisle, and it is labeled for a completely different use. You are looking for products designed to stop menstrual bleeding, specifically products containing tranexamic acid. Tranexamic acid is an antifibrinolytic. It prevents the breakdown of clots. In a trauma scenario, it is one of the most effective drugs for stopping hemorrhage that does not require IV administration. It comes in oral form. It is sold over the counter in some countries and behind the counter in others. If your pharmacy has it, you take it. If it is behind the counter, you ask for it by name. If they will not give it to you, you remember where it is stored. Here's the threshold. You need enough hemostatic gauze to pack 3 major wounds. Each wound requires approximately 2 to 4 packs depending on depth. That means you need between 6 and 12 packs total. More than 12 is redundant unless you are planning to treat multiple people, in which case you scale linearly. 1 person equals 12 packs maximum. Beyond that, you are carrying weight that does not increase survivability. For tranexamic acid, the dosage is 1 gram immediately, followed by 1 gram over 8 hours. Each person requires 2 grams per traumatic event. A bottle typically contains 15 to 30 grams. 2 bottles cover multiple events for one person or single events for multiple people. More than 2 bottles is excessive unless you are staging a field hospital. Now here's what kills people. They take the hemostatic materials and they do not take the adjunct materials that make them effective. Hemostatic agents require pressure. Pressure requires mechanical advantage. Mechanical advantage requires tools. You need trauma shears to cut away clothing without moving the patient. You need a tourniquet to isolate limb hemorrhage above the wound site. You need chest seals for penetrating thoracic trauma. These are not optional. These are the materials that convert a hemostatic agent from a product into a capability. Tourniquets are not in the first aid aisle. They are in the sporting goods section or the diabetic supply section, sold as resistance bands or reusable straps. You are not looking for a medical tourniquet. Those are expensive and often locked up. You are looking for any strap that is 1 to 2 inches wide, that can be tightened with a windlass, and that will not stretch under load. Velcro straps. Adjustable resistance bands. Anything that meets those criteria. You need 2, 1 for each major limb category. More than 2 is redundant. Chest seals are not sold in pharmacies. This is a gap you cannot fill here. You will need to source them elsewhere or improvise them from occlusive materials, which means plastic sheeting and medical tape. The pharmacy has both. Heavy gauge plastic sheeting is sold as drop cloths in the seasonal section. Medical tape is sold in the first aid section. You need 1 roll of each per person. This is the minimum to create an improvised chest seal that will hold pressure. The trauma shears are often behind the pharmacy counter because they are considered a tool, not a medical device. You ask for them by name. Trauma shears, not scissors. Scissors bind on thick fabric. Trauma shears have a blunt tip and serrated edge designed to cut through denim, leather, and seat belts without puncturing skin. You need 1 pair. They last indefinitely. Here's the part that matters. Hemostatic capability is the only category where speed is more important than quantity. If you are in a scenario where you are extracting materials from a pharmacy under time pressure and you can only take 1 category, this is the one. Because this is the category that addresses the failure mode with the shortest timer. Infection kills you in days. Dehydration kills you in 3 to 5 days. Hemorrhage kills you in minutes. Minutes is the timer you cannot afford to lose. The second reason this category is first is psychological. Hemostatic capability is the thing that keeps people in the fight. When someone is bleeding, everyone stops. The entire group stops. Decision-making stops. Forward movement stops. Everything becomes about the bleeding. If you can stop the bleeding in 60 seconds, you restore momentum. If you cannot, you lose the group. They freeze. They panic. They make noise. Noise is compromise. Compromise is death. The third reason is that hemostatic materials are the first thing that disappears. Not because people know what they are, because people recognize the word trauma, trauma gauze, trauma shears, trauma kit. The word signals importance even to people who do not understand the function. Once the pharmacy is breached, these materials are gone in the first wave. Not because people know how to use them, because they know they should have them. So here's your extraction protocol for category 1. You enter the pharmacy. You ignore the prescription counter. You ignore the controlled substances. You move directly to the first aid aisle. You locate hemostatic gauze by reading the active ingredients, not the brand names. You take 6 to 12 packs. You locate trauma shears and tourniquets. You take 2 tourniquets and 1 pair of shears. You move to the women's health aisle. You locate tranexamic acid if available. You take 2 bottles. You move to the seasonal or household section. You take 1 roll of heavy plastic sheeting and 1 roll of medical tape. Total time, 4 minutes. Total weight, less than 3 pounds. That's category 1. Category 2 solves a different problem. It solves the problem of everything else that's trying to kill you after you've stopped the bleeding. Category 2 is disinfection infrastructure. Once you stop the bleeding, the timer resets. Now you are racing against infection, and infection is a slower death, but a more certain one. In collapse conditions, a simple laceration has a mortality rate that climbs toward 30% within 72 hours if you do not have the ability to create a sterile field. This is not because the wound is severe. This is because the environment is contaminated and your immune system is already compromised by stress, malnutrition, and sleep deprivation. You need the ability to kill microorganisms on surfaces, in wounds, and in water. Most people grab isopropyl alcohol. Alcohol is sold everywhere. Alcohol evaporates. Alcohol has a flammability problem. Alcohol stings, which means people avoid using it on wounds, which means wounds do not get disinfected. Alcohol is also relatively weak against bacterial spores and certain viruses. It works, but it is not the optimal solution. The optimal solution is povidone iodine. It is sold under multiple brand names, most commonly as betadine. It is a brown liquid that looks like weak tea. It does not sting, it does not evaporate. It is effective against bacteria, viruses, fungi, and spores. It is stable for years if stored in a dark container. It is cheap, it is available over the counter in every pharmacy, and almost nobody takes it because it looks old-fashioned. Povidone iodine comes in two forms. The first is a solution, typically 10% concentration. This is used for wound irrigation and surface disinfection. The second is a scrub, which includes a detergent. The scrub is used for pre-surgical skin preparation. You need both. The solution for wounds. The scrub for intact skin. The distinction matters because using scrub in an open wound introduces surfactants into tissue, which delays healing. Using solution on intact skin is less effective because you are not mechanically removing surface oils and debris. Here's the threshold. One bottle of solution is typically 4 to 8 ounces. You need approximately 1 ounce per significant wound irrigation. A bottle covers 4 to 8 wound events. 2 bottles cover most scenarios for one person. The scrub is used. You use approximately 1 ounce per scrub session. A bottle covers 7 to 16 sessions. 3 bottles cover most scenarios. Now here's the capability that people miss. Povidone iodine is also a water disinfectant. At a concentration of 8 drops per liter, it renders most waterborne pathogens inactive within 30 minutes. This is a backup disinfection method when you do not have access to boiling or filtration. The taste is metallic and unpleasant, but the water is safe. 1 bottle of solution can disinfect over 200 liters of water. This is a secondary function that becomes primary when your filtration system fails. The second material in this category is hydrogen peroxide, not for wounds. For surfaces, hydrogen peroxide is sold in brown bottles at 3% concentration. It is used for cleaning contaminated surfaces and for creating a sterile field when you do not have access to pressurized steam or dry heat. It works by releasing oxygen radicals that disrupt cell membranes. It is effective, it is cheap, and it degrades into water and oxygen, which means it does not leave toxic residues. The threshold for hydrogen peroxide is volume dependent. A standard bottle is 16 ounces. You use approximately 4 ounces per surface disinfection event if you are creating a sterile field for a procedure. A bottle covers 4 events. 3 bottles cover most scenarios. Hydrogen peroxide also has a secondary use as a mouthwash at diluted concentration, which matters when dental infections become life-threatening and you do not have access to antibiotics. The third material is chlorhexidine gluconate. It is sold as a surgical scrub or as a mouthwash. As a scrub, it is superior to alcohol for skin disinfection because it has residual activity. It continues to kill bacteria on the skin for up to 6 hours after application. As a mouthwash, it is the most effective agent for preventing oral infections, which are common in collapsed conditions due to poor nutrition and inability to maintain oral hygiene. Chlorhexidine comes in concentrations ranging from 0.12% for mouthwash to 4% for surgical scrub. You need the 4% scrub. 1 bottle is typically 4 to 16 ounces. You use approximately 1 ounce per scrub session. 2 bottles cover most scenarios. The mouthwash is secondary. If available, take 1 bottle. If not, it is not critical. Now here's the structural problem with disinfection. Disinfection is invisible. You cannot see bacteria. You cannot see viruses. You do not receive immediate feedback when you disinfect a wound. This means people under-disinfect or skip disinfection entirely because they do not perceive the threat. The threat is real. The threat has a 72-hour lag time. By the time you see the infection, you are already behind the curve. The second structural problem is that disinfection requires redundancy. You cannot disinfect a wound with contaminated hands. You cannot disinfect hands with contaminated water. You cannot disinfect water with contaminated containers. The entire chain has to be sterile, which means you need enough disinfectant to address every link in the chain. This is why threshold quantities matter. 2 bottles is not excessive. 2 bottles is the minimum to maintain a sterile protocol under field conditions. The third structural problem is that disinfection is time sensitive. Povidone iodine requires contact time. Hydrogen peroxide requires contact time. Chlorhexidine requires contact time. Contact time means the disinfectant has to remain on the surface long enough to kill the microorganisms. Most people rinse too quickly. Most people do not understand that a 10-second rinse is not the same as a 2-minute soak. The difference is mortality. Here's your extraction protocol for Category 2. You move to the wound care aisle. You locate povidone iodine solution and scrub by reading the active ingredient, not the brand name. You take 2 bottles of solution and 3 bottles of scrub. You locate hydrogen peroxide in brown bottles at 3% concentration. You take 3 bottles. You locate chlorhexidine gluconate at 4% concentration. You take 2 bottles. If chlorhexidine mouthwash is available at 0.12%, you take 1 bottle. Total time, 3 minutes. Total weight, less than 5 pounds. That's Category 2. You now have the ability to stop bleeding and prevent infection. Category 3 solves a different problem. It solves the problem of what happens when disinfection is not enough and you need systemic intervention. Category 3 is antibiotic infrastructure. Disinfection is external. Antibiotics are internal. Disinfection prevents infection. Antibiotics treat infection. The gap between the two is the gap between prevention and response. And in collapse conditions, you will need both because you will not always be able to prevent what you need to respond to. Here's the problem. Antibiotics are prescription controlled in most developed countries. You cannot walk into a pharmacy and take them off the shelf. They are behind the counter. They are tracked. They require a prescription pad or a pharmacy override. This is a regulatory barrier, not a physical one. The antibiotics are there. You just cannot access them through normal channels. But there is a gap in the system. A specific category of antibiotics that is legally available without prescription, that is chemically identical to human antibiotics, and that is sold in quantities large enough to be useful. You are looking at the veterinary section. Specifically, aquarium antibiotics and livestock antibiotics. These are the same drugs. Same active ingredients, same mechanisms of action, different labels. Fish antibiotics are sold online and in pet stores, but some pharmacies carry them in the pet care aisle. The most common formulations are amoxicillin, ciprofloxacin, metronidazole, and doxycycline. These cover the majority of bacterial infections you will encounter. Amoxicillin for respiratory and soft tissue infections, ciprofloxacin for gastrointestinal and urinary infections, metronidazole for anaerobic infections and parasites, doxycycline for tick-borne illness and respiratory infections. The dosage is identical to human dosage. A 500 milligram capsule of fish amoxicillin is the same as a 500 milligram capsule of human amoxicillin. The manufacturing standards are lower, which means there is more variation in filler materials, but the active ingredient is the same. You dose by body weight. You follow the same protocols. You watch for the same side effects. Here's the threshold. A typical course of antibiotics is 7 to 14 days depending on the infection. Amoxicillin is dosed at 500 milligrams 3 times per day, which is 1.5 grams per day, which is 10.5 to 21 grams per course. A bottle typically contains 30 to 100 capsules at 500 milligrams each, which is 15 to 50 grams total. 2 bottles cover 2 full courses with redundancy. Ciprofloxacin is dosed at 500 milligrams twice per day, which is 1 gram per day, which is 7 to 14 grams per course. Same calculation, 2 bottles. Metronidazole is dosed at 500 milligrams 3 times per day for anaerobic infections, or 2 grams as a single dose for parasitic infections. 2 bottles cover multiple courses. Doxycycline is dosed at 100 milligrams twice per day, which is 200 milligrams per day, which is 1.4 to 2.8 grams per course. 1 bottle typically contains 60 to 100 capsules at 100 milligrams each. 1 bottle covers multiple courses. Now here's what kills people. They take the antibiotics and they do not take the adjunct materials that determine whether the antibiotics work. Antibiotics require proper dosing. Proper dosing requires measurement. Measurement requires a scale if you are breaking tablets or estimating powder. The pharmacy sells digital scales in the diabetes section for measuring insulin or food. You need one. It costs less than $20. It weighs 4 ounces. It ensures you do not underdose, which creates resistance, or overdose, which creates toxicity. The second adjunct material is probiotics. Antibiotics kill bacteria indiscriminately. They kill the infection and they kill your gut microbiome. Loss of gut microbiome causes diarrhea, which causes dehydration, which kills you faster than the original infection in some cases. Probiotics restore the microbiome. They are sold in the digestive health aisle. You are looking for products containing lactobacillus and bifidobacterium strains. The count matters. You need at least 10 billion CFU per dose. One bottle contains 30 to 60 doses, one bottle per person. The third adjunct material is oral rehydration salts. Diarrhea from antibiotics or from the infection itself causes electrolyte imbalance. Electrolyte imbalance causes cardiac arrhythmia and cognitive impairment. Oral rehydration salts restore electrolyte balance faster than water alone. They are sold as pre-packaged sachets in the digestive health aisle or the travel section. Each sachet is mixed with 1 liter of water. You need 10 sachets per person to cover a severe diarrheal event. 20 sachets cover redundancy. Now here's the doctrine. Antibiotics are not first line. Antibiotics are third line. First line is disinfection. Second line is immune support through rest, hydration, and nutrition. Third line is antibiotics. You do not use antibiotics for every infection. You use antibiotics for infections that are systemic, that are progressing despite disinfection, or that are in anatomical locations where disinfection cannot reach. Dental infections, sinus infections, deep tissue infections, pneumonia. The reason this matters is that antibiotics are a finite resource. You cannot manufacture them. You cannot substitute them. Once you run out, you are done. Every course you use is one fewer course you have available. This means you need a decision framework for when to start antibiotics and when to wait. The framework is based on 3 indicators: fever above 101 Fahrenheit for more than 24 hours, visible signs of systemic infections such as red streaking from a wound or swollen lymph nodes, failure to improve after 48 hours of disinfection and rest. If all 3 indicators are present, you start antibiotics. If only 1 or 2 are present, you wait and reassess every 12 hours. This is not about being conservative. This is about being sustainable. Antibiotics are the difference between a 3-month collapse and a 3-year collapse. You use them when they are necessary. You do not use them when they are optional. Here's the second doctrine. Antibiotics are identity independent. Unlike prescription medications, antibiotics do not care who takes them. A 500 milligram dose of amoxicillin works the same in you as it does in anyone else of similar body weight. This means antibiotics are tradable. They are currency. They are leverage. In a prolonged collapse, antibiotics become more valuable than food because food is renewable and antibiotics are not. You take more than you need for yourself because you will need them for bargaining. The threshold for bargaining capacity is 4 full courses per person, 2 courses for personal use. 2 courses for trade. Each course of amoxicillin is approximately 21 grams, which is 42 capsules at 500 milligrams. 4 courses is 168 capsules. That is 4 to 6 bottles depending on bottle size. For ciprofloxacin, 4 courses is 56 grams, which is 112 capsules, which is 3 to 4 bottles. You scale the same way for metronidazole and doxycycline. Here's your extraction protocol for Category 3. You move to the pet care aisle if the pharmacy has one. You locate fish antibiotics or livestock antibiotics by reading the active ingredient. You take 2 bottles each of amoxicillin, ciprofloxacin, metronidazole, and doxycycline if available. If the pharmacy does not stock veterinary antibiotics, you note the location of the prescription area for potential secondary access. You move to the diabetes section. You take 1 digital scale. You move to the digestive health aisle. You take 1 bottle of probiotics with at least 10 billion CFU. You take 20 sachets of oral rehydration salts. Total time, 4 minutes. Total weight, less than 4 pounds. That's Category 3. You now have hemostatic capability, disinfection infrastructure, and antibiotic capacity. Category 4 is about time. Category 4 is pharmaceutical stability. Expiration dates are a legal construct. They are not a chemical reality. The FDA requires expiration dates on medications as a liability shield. The manufacturer tests the medication for stability over a defined period, typically 2 to 3 years, and then prints that date on the label. This does not mean the medication degrades the day after the expiration date. It means the manufacturer is no longer legally responsible for guaranteeing its potency beyond that date. The actual degradation rate of most medications is far slower. The Department of Defense conducted a study called the Shelf Life Extension Program, which tested over 3,000 lots of expired medications from military stockpiles. The result? 90% of medications retained full potency for at least 5 years past their expiration date. Many retained potency for 15 years or longer. The exceptions were liquid formulations, which degrade faster due to water content, and a small subset of antibiotics like tetracycline, which break down into toxic compounds. This means that the medications sitting on the pharmacy shelf right now, the ones with expiration dates 6 months or 2 years out, are actually stable for a decade or more if stored correctly. Stored correctly means cool, dry, dark conditions, no humidity, no temperature swings, no light exposure. A sealed container in a climate-controlled space will preserve most medications far beyond their labeled expiration. Here's why this matters. In a collapse scenario, you are not just planning for the next 6 months. You are planning for the possibility that pharmaceutical manufacturing does not resume, that the supply chain does not rebuild, that you are working with a fixed stock of medications for years. The medications you take now have to remain viable for the entire duration. This means you prioritize medications with the longest chemical stability, and you avoid medications that degrade quickly. The most stable category is analgesics and anti-inflammatories. Aspirin, ibuprofen, acetaminophen, naproxen. These are simple molecules. They do not degrade unless exposed to moisture. A bottle of ibuprofen stored properly will retain potency for decades. The threshold is quantity. You need enough to manage chronic pain, acute injuries, and fever for multiple people over multiple years. The standard dose of ibuprofen is 400 to 800 milligrams every 6 to 8 hours. At the high end, that is 2.4 grams per day. Over 1 year, that is 876 grams. Over 5 years, that is 4.38 kilograms. A standard bottle of ibuprofen contains 100 to 500 tablets.